Amit Parasnis. I am Head of Department of Surgical Oncology at Manipal Hospital, Baner. Let us talk about gynecological cancers. There are three different gynecological cancers which are common, and the treatment we need to discuss. One is cancer ovary, cancer cervix, and cancer endometrium. Let us talk about cancer ovary. Ovaries are nothing but two pear-shaped organs inside the abdomen which are connected to the uterus by fallopian tubes, and they can form tumors or cysts, and they can spread through the abdominal cavity in the form of formation of fluid in the abdominal cavity or nodules in the abdominal cavity. More often than not, these present in stage 3, and so these tumors, ovarian cancer, needs to be treated with chemotherapy first, 2 or 3 cycles, and then operation in the form of removal of uterus and ovaries and lymph nodes and omentum, which is nothing but a layer of fat in the abdomen, plus any nodules if there are present. And then this surgery, after recovery, there is again 3 cycles of chemotherapy which are given. The latest advance in ovarian cancer surgery is something called as high intensity intraperitoneal chemotherapy, wherein the abdominal cavity is subjected to chemotherapy during the time of surgery. So this is done in cases of high cancer cell load. This is as far as ovarian cancer is concerned. Coming to cervical cancer, cervix is the lowermost part of the uterus, and the cancer was common earlier in Indian population, but now number 1 cancer is breast cancer. So cervical cancer in early stages can be treated with surgery, that is the radical removal of the uterus along with lymph nodes and ovaries and tubes. In stage 1 and 2, radical radiotherapy also has a very good effect of disease control. As this progresses, stage 2B and stage 3, the radiation is the only form of treatment which works, because surgery becomes not possible because of the inability to get wide margins. So in stage 2-3 of cervical cancer, we treat it with radiotherapy. Stage 4 is a very advanced cancer, and we have to treat it with a palliative intent in the form of symptomatic treatment or chemotherapy, and sometimes palliative radiotherapy. Coming to endometrial cancer, endometrium is nothing but the lining of the uterus, the inside lining of the uterus, and again in early stages it is treated with surgery. So the surgery in endometrial cancer can be performed by the minimal access or laparoscopic or robotic assisted technique. In it, we remove the uterus, the ovaries and the tubes along with lymph nodes in the abdomen. Surgery for endometrial cancer will be followed by chemotherapy and radiation if required. Thank you very much.